Hello and welcome to this introduction into Homeopathic Facial Analysis, or HFA. My name's Grant Bentley and I'm the founder of this method. The HFA Miasmatic Model is based on Hahnemann's miasmatic model of 3 primary miasms. Each miasm is seen as a force or a motion. Every remedy also has an internal force or motion. For example, the centrifugal action of Psora, and this force needs to be matched to the miasmatic force of your patient. The force in the patient is their dominant miasm. The dominant miasm is with the patient for life. For all chronic complaints, remedies with the same miasmatic motion as the patient must be chosen. These remedies will act far more deeply. The HFA miasmatic model consists of the 3 primary Hahnemannian miasms of Psora, syphilis and psychosis. 3 dual miasms where 2 miasms of equal strength join, and 1 trio miasm where 3 miasms of equal strength join, making a total of 7 miasms. I also ask you to see aphorism 40 and 42 for how miasms join. The 3 primary miasms have no greater strength nor greater importance than any of the other 4 miasms, but they do create the platform for the other miasmatic groups. So in the HFA miasmatic model, Psora is allocated the colour yellow, psychosis red and syphilis blue. This helps us understand the joint miasms. Every face shows elements of Psora, psychosis and syphilis. Faces dominant in psoric features means that that patient is psoric. Dominant psychotic features equals a psychotic patient, and dominant syphilitic features means a syphilitic patient. Equal psoric and psychotic features equals psychopsoric patient, equals psychotic and syphilitic features a psychosyphilitic patient, equals psoric and syphilitic features a tubercular patient, equals psoric, psychotic and syphilitic features equals a cancer patient. So in the HFA model, when we look at the triangle, we see the dominant miasm is Psora, which is yellow, psychosis red, syphilis blue, and the combination of these colours means that psychopsora is orange, psychosyphilis is purple, equal amounts of Psora and syphilis is green or tubercular, and then equal amounts of Psora, psychosis and syphilis is brown. In the HFA model, the miasm is a force or motion. This force is not removed, but we do work with it. And this means clinical outcomes are strong and efficient. This method gives new graduates confidence in choosing their remedies. HFA takes 5 to 10 minutes for analysis, but saves 30 minutes at least in choosing remedies. The HFA miasmatic model encompasses classical case-taking techniques plus generalised case repertorization with special emphasis on the modalities, plus the miasm, which is based on facial structure, and this equals a totality miasm-based remedy. In HFA, we only rate psoric, psychotic and syphilitic facial features. We take photos of a patient's face from a number of angles. We add up the points from each of these 3 primary miasms. Where a single primary miasm, Psora, psychosis or syphilis, is dominant, the patient gets a remedy from that miasmatic group. The same applies to the 3 duo and 1 trio miasm. In HFA, we take 9 photographs. Why learn a new diagnostic? Practicing homeopathy using HFA is great because 1, it's straightforward and easy to learn. HFA helps find deep-acting remedies quickly. HFA makes clinical practice a process that's easy to follow. HFA reminds us of the universal laws of energy and of nature, and HFA is Hahnemann's legacy. In HFA, we look at facial features regardless of age, gender and race. But back to the three forces. We have Psora, syphilis and psychosis. There is energy inside matter. These three particles form all of matter. Each particle has its own energy pattern and relationship to the three miasms. Outward motion is Psora, which is seen as centrifugal motion, and in us it protects vital organs by expelling infection out to the periphery. Circular motion is psychosis, creating a barrier that contains and separates infection and stops it from spreading to the vital organs. Inward motion, or syphilis, withdraws energy from the periphery into the vital organs to protect them while the immune system deals with the infection. Nature uses these three forces in a variety of ways. For example, outward motion is used in radiating light and heat. People use outward motion to push infection to the periphery. Remedies like sulphur are dominant in outward motion. Outward motion is Psora. Psoric remedies and psoric patients are dominant in outward motion. The natural uses of circular motion include the cycles of life and the circular motion of the planets. In people, circular motion traps infection and creates a barrier between the vital organs and the infection. Remedies like Thuya are dominant in circular motion. Circular motion is psychosis. Psychotic remedies and psychotic patients are dominant in circular motion. The natural uses of inward motion include gravity and conserving energy, as well as cold and contraction. In people, inward motion conserves and prioritises energy towards the vital areas. Remedies like mercury are dominant in inward motion. Inward motion is syphilitic. Syphilitic remedies and syphilitic patients are dominant in inward motion. Yellow or psoric outward motion has facial features that are aerodynamically shaped to match its moving motion. These features will be small, sloped, angled, and include multiple lines. In red or psychosis, circular motion is seen by facial features that are circular, round, or we include the straight line of the barrier. The blue syphilitic motion has features that are crooked, inward, deep and sharp, showing that withdrawal of energy from the periphery to the centre. In HFA, we have 70 facial features. Each is allocated to one of the three primary miasms of yellow, red or blue, and 1 point is allocated to each feature. Features are added up onto a chart and the patient's dominant miasm is then seen. Here are some examples of the facial features from each miasmatic group. The hairline of yellow, the forehead of blue, the bridge of red, the hairline of red, the brow of red and the teeth of blue. After the consultation, we take the photos and the features are placed on a simple miasmatic chart. We then calculate this chart for it to tell us what miasm is dominant. As you can see in this chart, this patient is dominant in both yellow and blue, Psora and syphilis, so they would be green patient or a tubercular patient and need a tubercular remedy. There is an online training course with B. Jane regarding HFA. Classes are recorded with both myself and my other co-founder, my wife Louise. 10 classes will cover the HFA technique, 10 classes covering HFA facial analysis, and they all give clear instructions, case examples and facial analysis examples. I look forward to joining you in this course. Thank you.